I think Health and Aging Services Administration is a noble field. It's a calling. And by the way, I am very excited about this group. I think that you are going to have a blast these 4 days. And I think we're going to come up with something that, if we listen to you, which you're going to hear about today, we're going to come up with something that is really powerful. Just to start off, I don't think it's okay that Long-Term Care Administration, Health and Aging Services Administration doesn't get the very best people in the world.
Hey, I'm Chad Blackard from Jackson, Mississippi, and it's just been a pleasure to be part of other leaders and administrators that are committed to our industry. This experience has been fantastic, and my takeaway is that I'm committed to improving the image of long-term care administrators.
On the profession, there is this decline of applicants and renewals going on right now. The last 4 or 5 years, 2002, 2008, there's this kind of decline of people going into classic NHA, right? Okay, so there's a little bit of that. It's kind of leveled off a bit the past few years, but there's some supply indicators. Fragile educational field, unbelievably fragile. It's scary. It is scary. NAV accredited programs, right? We have 7 accredited programs in the country, and I will tell you, they're not universally strong.
My name is Dawn Miller. I'm from Peoria, Arizona. And I just have to say, what a group of amazing, passionate professionals. I mean, I knew, I just never expected to meet such a great group of people. That was amazing. But my takeaway is that I really didn't see the differences between states and how that's going to require some commitment, and follow-up to get some of those changes made.
All right, read them down real fast, bro.
Lazy, resistant, caring, younger, motivated, needy, frustrated, out of question why, good job, hardworking, compassionate, entitlement, challenging, disloyal, inquisitive.
Nice job.
Me, impatient, techno-savvy, no critical thinking, and expect excellence.
Excellent, excellent. Let's give Brooke a round of applause. Man. Nice job. How many thought she was better than Dr. Olson this morning? Raise your hand. All right. Now, who are they? Let me preface this by saying, okay, every generational expert in the United States claims their territory on how they define the generations, okay? I really would prefer to stay out of all that. Frankly speaking, we never really used to even measure generations until the late 60s, early 70s. Before that, all the data we had on employees and families was based on census, right?
Yeah.
And how often do they take the census? So.
Because what I really learned, what I've taken away from here, is the energy and enthusiasm that all you have, and it's invigorating to see that if nothing else, on your backs, this profession is going to go places.
Idea I don't want to be. All right, so there's also some flexibility stuff that people like, even though you might feel low. And you guys also brought up some neat things about liking, leadership development, quality initiative, lots of impact on people's lives. I mean, that's kind of what we do. We do it well. That's what you like the best. And actually, I shared that with some of the speakers for tomorrow, so they'll have that. What was your least favorite? Number 1, regulatory constraints in the regulatory environment. Number 2 is financial constraints, and then 3 was managing staff. So regulation still, by and large, and we'll report this, by the way. I mean, part of the white paper will be, how does this group feel about things? Now, is it going to change anything? I don't know.
I'm Tamara Geiwitz, and I'm from the Baltimore area in Maryland. And my biggest takeaway from this has been how inspiring it is to meet all these professionals that are all interested in the same thing, and the power I think that we will have, even in our small numbers, of making innovative changes in our field.
board. So it was important to me to come here to network with other individuals that felt the same way. And I was really excited to hear from the variety of people that we heard from. So thank you very much for putting that together. Really appreciate that. My takeaway is definitely going to be more involvement in not only the professional organizations, but the provider organizations too. And that's more involvement than just paying my dues every year. So that's it.